Hello, everyone. Hi, Lisa. Hello. How's everyone doing today? Thank you for joining. We'll just wait a few more minutes and we can start at like 12:04. Hi, Brendan. Thanks for joining. Just wait a few more minutes and then we can start. Hope everyone had a great Friday morning. It's so nice outside. Oh my gosh, yeah, I'm gonna go outside after. Yeah, I'm excited. It looks really beautiful. Yeah. All right. Okay, so I'm gonna go ahead and get started. My name is Ibukunoluwa, and I use she, her pronouns, and I'm the Social Media Outreach Prevention Coordinator and HIV tester at Whitman-Walker. I'm an AmeriCorps Fellow. And today's live is about sexual health. We chose this live today because September is Sexual Health Awareness Month, so it's really important that we start having these conversations more frequently with each other. Today is just going to be Basic Sexual Health 101. And during the past few months, Whitman-Walker's Community Health Department has expanded its outreach efforts to the social media platform. We cover various topics about HIV/STI sexual health practices, access to care, social determinants of health, and general public health interventions. The next series of outreach sessions will focus on the current pandemic, COVID-19, and ways to manage your sexual, personal, and mental health. The community health team is here to educate and support you. So this month of September is dedicated to raising awareness about sexual health. Sex is a normal aspect of human life, and it is important that we are all well informed about our sexual health. According to the World Health Organization, sexual health is defined as a state of physical, emotional, mental, and social well-being in relation to sexuality. It is not merely an absence of disease, dysfunction, or infirmity. Sexual health requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences free of coercion, discrimination, and violence. So like I said earlier, throughout the month of September, I'm going to come on here and talk about different topics regarding sexual health. And just to begin us today, I want to discuss STIs and the importance of getting frequent testing, as well as the resources available to access free and affordable testing in DC, in the DMV area. So let's begin first with, what is an STI? An STI is a sexually transmitted infection that is spread by sexual contact, whether that is vaginal sex, oral sex, or anal sex. There's plenty of sexual transmitted diseases, but today I want to focus on chlamydia, gonorrhea, and syphilis, which are the three STIs are Whitman-Walker can test with our self-test. And Whitman-Walker Health offers a free STI self-test kit, which will include a urine sample, rectal swab, and oral swab for gonorrhea and chlamydia, and a blood draw for syphilis. Sorry, excuse me. Now you may be wondering, why is it important for us to test for these three? Well, chlamydia, gonorrhea, and syphilis are the top three most common STIs in DC. Chlamydia, gonorrhea, and syphilis also are often asymptomatic, which means a lot of people end up going untreated because they're not presenting with any symptoms. And HIV as well can also stay asymptomatic for many years. One thing I do want to note is that an individual who is diagnosed with syphilis will always test positive for the STI, regardless of if they got treated or not. They will just consistently test positive. But it's still important for people to get their frequent testing just so they are up to date on their sexual health. Now, you may be wondering, how often should I get tested? Well, it's recommended that a sexually active individual receives testing every 3 months. So, if you are sexually active, you want to get tested every 3 months. And as your sexual encounters increase or your risk factors increases, we recommend that you also increase your testing. And it is also important to get tested frequently because although you may not know you have an STI, you want to keep your own body healthy and you also don't want to give anything to anyone else. So like I said earlier, Whitman-Walker does offer a free confidential HIV/STI testing at our 1525 14th Street Northwest, as well as the Max Robinson Center in Southeast DC in Anacostia, at the corner of Martin Luther King Jr. Avenue and Chicago Street. And just a heads up, currently due to the pandemic, every test is by appointment only, but it's really easy to schedule a test. You just call us at 202-797-4439. And you can just call and say, hey, I just want to make an HIV/STI test, and we will get you in as soon as we can. And also, these are free tests, so they come with no cost. And also, if you are living in the DMV and you can't get to our DC locations, there's also other resources that I would like to share with you. There's Unity Health, and that's located at 3020 14th Street Northwest, Washington, DC. And they also offer STI HIV testing, and they are by appointment and walk-in basis. And the number to call for that is 202-469-4699. There's also Medics USA, which is located at 1700 17th Street Northwest, Washington, D.C. They also offer STI and HIV testing on a walk-in or appointment basis. And to call them, it's 202-483-4400. And along with receiving a test from Whitman-Walker or any of the other health clinics in the DMV that I mentioned, there's also an alternative known as in-home testing. So the benefit of these tests is that you can do them in the privacy of your home, and you also have the flexibility of choosing which STI you want to test for. These tests can be purchased at CVS, either online or in person, or you can also purchase them at everlywell.com. These tests can range from $80 to $200. I'm so sorry, for the STI testing kits, as well as the HIV test kits. We do want to note that because these tests are self-administered, there could be user error by doing them yourself. So if you feel like your test isn't accurate, please call us at our resource line if you need any help. And like I said, we're always here to help. And before I leave, I just want to ask, does anyone have any questions? I see that Brendan noted that, 3-month testing is key. It's really important that you schedule these. Honestly, when you come for your 3-month test, you could also just schedule for the next one in the next 3 months. That's a good practice to follow. That's a very important thing to note. Does anyone have any questions or any things they would like me to clarify? All right. Well, before we go, I just want to give you a few reminders about the COVID-19 and the vaccines. So if you've already gotten vaccinated, congratulations. You've taken a really important step to preventing yourself, your loved ones, and your communities from the illness. The Delta variant is soaring across the entire United States at this moment, and it's totally understandable why you might want to keep wearing your mask. The vaccine isn't 100% effective, as more contagious variants are spreading. And there are very few protocols in place to actually verify whether the people around you are vaccinated or not. So keep on staying alert. And if you haven't gotten vaccinated yet and you're looking for an appointment, Whitman-Walker Health has COVID-19 vaccines available. Everyone ages 12 and up are eligible to receive the Pfizer COVID-19 vaccine, and everyone ages 16 and up are eligible to receive a COVID-19 vaccine. So please reach out to us at 202-207-2480 to make an appointment. And if you're having trouble making an appointment with us, there's also other resources for you to go to. For our DC residents, you can find information on, your nearest testing center by going to vaccinate.dc.gov or by calling 1-855-363-0333. For our Maryland residents, you can also find out more about COVID vaccinations by going to covidlink.maryland.gov or by calling 855-634-6829. And for our Virginia residents, you can call 877-829-4682, or you can go to the website vaccinate.virginia.gov. And if you haven't been vaccinated and you are not looking for an appointment, we urge you to still continue to follow the CDC guidelines for mask wearing, quarantining, social distancing, and everything else. It is very important that you get the vaccine, or you can discuss the coded precautionary measures with those around you. And also be mindful of the mask mandates in your states and keeping your distance, especially when you do not know whether the people around you have been vaccinated or not. And if you would like to support Whitman-Walker, please register to walk, run, or donate to this year's virtual walk and 5K to end HIV, which is occurring on Saturday, October 23rd. And this is a really special year for us because it's the 35th anniversary of the walk. So please register yourself or your team at walktoendhiv.org. And remember, please support us on social media by following us on our Instagram, Facebook, and Twitter at Whitman-Walker. And also check out the website. You can find a lot of resources and a lot of information about any of the services we offer at whitman-walker.org for the most up-to-date information. And finally, you can always call us at 202-797-4439. Thank you so much for coming today. I hope you guys have a beautiful Friday, and please go outside and enjoy the fresh air. Bye.